My name is Tina Sheehy. I'm an FNP student at UNG, and the title of my research project is Healthcare Providers and Cultural Sensitivity. Approximately 29% of the United States population is minorities. That number is expected to increase to 50% by 2050. Not only are chronic illnesses more prevalent in minorities, but they are less likely to receive adequate health care and more likely to develop severe complications such as chronic kidney disease, dialysis, and amputations. Unmet healthcare needs lead to preventable hospitalizations and heavy financial burdens. Reducing healthcare disparities and removing barriers to healthcare is also a significant goal of Healthy People 2020. Providing culturally sensitive healthcare not only reduces healthcare disparities, promotes good health, and reduces healthcare costs for unnecessary treatment, it ensures compliance with federal, state, and organizational standards of care. Morbidity and mortality rates from chronic health issues such as diabetes continue to be high among minorities despite the recent push to promote cultural awareness in healthcare. Among research findings was a positive correlation between cultural sensitivity training of healthcare workers and patient satisfaction. One common theme which emerged from the literature is there are variables which will determine the success or failure of the cultural sensitivity class aimed at increasing cultural awareness and promoting positive behavioral modifications in minority patients with diabetes and other chronic illnesses. Those variables are the patient, healthcare provider, and the cultural sensitivity program. Researchers have found patient and provider communication increases patient satisfaction, promotes adherence to medical advice, and results in improved health outcomes. Patients who feel valued and respected have a more therapeutic relationship with their healthcare provider and are more likely to be involved with their own healthcare plan and adhere to healthcare advice offered by providers. Healthcare providers' self-awareness about prejudices, ethnocentrism regarding their own culture, beliefs, and attitudes plays a crucial part in the patient-provider relationship. Studies indicate increasing the healthcare provider's awareness of these beliefs and attitudes about different cultures through a structured sensitivity program enables the provider to modify their interaction with the patient in such a way as to promote a healthy relationship with their patients from minority groups. The last significant variable identified in the literature that will affect the outcome of the project is the cultural sensitivity program's content. There is concern that commonly used cultural awareness programs have contributed to stereotyping and do not account for individuality of members of different cultural groups. It is for this reason, although the terms are used interchangeably, that diversity programs should focus on cultural sensitivity instead of cultural awareness. Cultural sensitivity acknowledges common practices and beliefs held by certain cultures while being aware there may be individual preferences or beliefs that do not align within their cultural norm. The research project's design is based on the model of cultural competence in healthcare delivery by Kempina Bacot. This model defines cultural competence as a process in which the provider is continuously attempting to work effectively within a multicultural environment. It requires the integration of cultural awareness, knowledge, skills, encounters, and desire. The project will be conducted at Good Samaritan Health Center of Gwinnett, which is a clinic in the Atlanta area that provides low-cost, multidisciplinary services to clients of various ethnic backgrounds. The project involves providing a cultural sensitivity training program for providers in 2 one-hour training sessions. The cultural sensitivity classes will be delivered via lecture and discussion using PowerPoint presentation and will incorporate interactive exercises adopted from the University of Houston's Diversity Activities Resource Guide. The lecture and PowerPoint topics included in class include communication, identifying the patient's preferred method of communication, language barriers, identifying potential language barriers, both verbal and nonverbal, cultural identification, identifying with which culture the patient identifies, comprehension, did the patient and the family understand and comprehend the situation or what's being said, beliefs, Identifying any religious or spiritual or healthcare beliefs the patient has. Trust. Do the patient and the family trust the healthcare provider? Recovery. Do the patient and the family have any misconceptions or unrealistic views about the caregiver, the treatment, or recovery process? Diet is addressing culture-specific dietary considerations. Assessments. Conducting assessments with cultural sensitivity in mind and healthcare provider bias. We all have biases and we all have prejudices. Examining and recognizing our own is very important. There are 3 types of interactive exercises that will be incorporated into the class. These are icebreakers designed to help participants feel more comfortable. Self-awareness activities, and these are designed to help facilitate self-awareness of our own personal biases and the level of diversity in our personal environments. Stereotyping and unpacking the ism activities are designed to create awareness of stereotypical thoughts and behaviors within society. To evaluate the effectiveness of the cultural sensitivity class, both qualitative and quantitative data will be collected. Qualitative data will be collected through a questionnaire using a 4-point Likert scale ranging from strongly agree to strongly disagree. This questionnaire will be administered to providers both pre and post class to evaluate their knowledge, skills, and attitudes before and after class. The quantitative data will be collected using a quiz in multiple choice true-false form over the content of the class. In an effort to avoid interrupting clinical activities and patient care activities, the class will be conducted during lunch. So the potential barriers anticipated include provider participation and class attendance. The class will be deemed a lunch and learn, and lunch will be provided to promote participation in class, and a makeup day for anyone who has to miss a class will be scheduled in an effort to encourage class attendance by all. The actual project will take place at Good Samaritan Health Center of Gwinnett the first week of February 2019 on the same day each week for 2 consecutive weeks. If there is need for a makeup date, it will be scheduled the second week of March 2019. The data will be analyzed by the second week of March 2019 and presented to the staff at Good Samaritan the first week of April 2019. The information will also be disseminated at the UNG Nursing Research Day via professional poster in the spring of 2019.